Welcome back to the final hour of the Gary Sutton Show on a Monday morning here on WSBA. And I read a really interesting article this morning, and I wanted to get an expert on this. And we go to this guy a lot, Dr. James Pinkney. He goes by Dr. James, family practitioner, CEO and founder of the Diamond Physicians. And the topic this morning is the doctor won't see you now. As newly insured seek care, rural doctor shortages worsened. And in a survey of 20,000 U.S. physicians, it shows 80% of doctors are overextended or at full capacity. We wanted to get at these problems this morning here on the Gary Sutton Show. We bring in Dr. James. Dr. James, always a pleasure to have you on, sir.
Oh, thanks for having me on.
Hey, I was looking at this article this morning. This thing is really intriguing to me. And it says, rural areas have long been strapped for doctors, but now the Affordable Care Act is further straining those limited resources. More people with insurance means more people will want to connect with a doctor, just as aging baby boomers require more care, the doctors are retiring. What's going on here?
Gary, that's exactly right. By 2025, we're going to need an additional 52,000 primary care physicians to keep up with demand. We're in big trouble here. This is a major problem.
It said that the ACA has funding this year now for 550 residents in underserved rural and urban areas nationwide. They said in Washington alone, 28 primary care doctors each year are completing their training in these communities thanks to ACA dollars ready to practice where they're needed most. But the other problem is, just as they're showing some results, there's key incentives and investments to boost family medicines are scheduled to end this year and next. I know Patty Murray, who's a senator, has tried to bring these back, but that still is up in the air right now, isn't it?
That is up in the air. And Medicare reimbursements, unfortunately, they're just not that high. So even with the boost, you're not talking about a lot of money there. So, yes, the ACA is generating 28 new doctors each year. But I just told you we're going to be down 52,000 in the next decade. So it's putting a very small dent in a very large problem. So what we have to do is completely reinvent our healthcare delivery model. And that's exactly what I've done at Diamond Physicians in order to incentivize young medical students to go into primary care and serve in rural and underserved areas.
It's interesting that, rural docs are kind of a rare breed to start with, right? I mean, they treat everyone from, crying kids coming out to faded elders. They set bones. They perform C-sections. They shock hearts back into rhythm. I mean, these guys are jack and ladies are jacks of all trades. They're exalted by a lot of people, obviously, in rural communities, but they're also exhausted. And it's a path that very few doctors seem to be willing to take. I was looking at one of the numbers. Only 3% of matriculated medical school students say they plan to practice medicine in a small town or a rural area, according to the recent survey by the Association of American Medical Colleges. So what do we do to incentivize that? How do we, talk about your model a little bit and how you're getting people to maybe see that as more attractive?
Right. These doctors are working very long hours, like you said, very low pay compared to specialists. Primary care doctors actually make 50% less than specialists, and it's a huge problem. So the first thing we have to do is give them a financial boost, and that's exactly what direct medicine does. We charge a monthly membership fee instead of charging insurance payers, and that allows our clients to have unlimited visits, no copay, and 24-hour access to their physician via cell phone or email. These rural doctors are already working so many long hours, and they have to be on call because they're the only doctor in the area. So why not switch to a direct medicine model and actually get compensated for your time? It will boost their salaries by 40%. They'll have a higher quality of time because they're always in touch with their clients. They can talk to them via cell phone, via email. You always know what's going on, and that's the beauty of our model. And we don't charge insurance. So we're able to provide a 90% discount on labs and imaging, and we include everything that these urgent cares and these ERs are charging astronomical figures for. So, for instance, if you get a stomach bug and you need IV fluids and you go to an urgent care facility, they'll charge you $300 for IV fluids. We charge our clients $0. We include it in the monthly membership fee. Same thing for laceration repair. Mm-hmm.
And I know you and I have talked about this before, but a lot of people are sitting there saying, oh, okay, a monthly membership fee. All right, now I bet you that thing goes through the roof.
Yeah, well, we charge $45 a month for kids.
Okay.
And adults start at $95 a month, and you can cut those costs even more in a rural setting. I'm paying heavy overhead here in the Park Cities and Dallas, $32 a square foot. So in a rural setting, your overhead will go down, and therefore you can lower your prices even further.
Wow. Now, why isn't everybody in the country doing this?
I'm asking myself the same question. It's very new, it's very innovative, and when you are fighting an uphill battle against a model that has been ingrained in our society for the last 30 years, it's going to be an uphill struggle. But as soon as people start finding out about direct medicine, and you can go to diamondphysicians.com to learn more, this trend will catch on. This is the future of healthcare in America. There's no doubt about that.
What are the biggest hurdles right now in recruiting physicians to rural areas beyond, let's say, the work and the monetary factors, which I know are two huge ones to start with?
Yeah, it's really tough because, again, you're going to be the only physician there. You're going to be working long hours, and you have a huge, huge financial debt from medical school. So if you know that you're going to go into a non-sustainable business model that forces you to work really hard, see an excessive number of patients per day in order to meet overhead, then you're probably not going to do that. It's not a smart choice. You're going to go into a specialist. You're going to go into surgery, somewhere where you can pay off your debt fast, make a lot of money, and take care of your family. And that's really why people don't go into primary care and don't go into primary care in rural areas, because it's even harder.
Yeah, they talk about it being hard for the physician's spouse to find work in an area with, relatively limited economic opportunities, right?
That's exactly right.
So getting that work-life balance, and that's something we don't think about enough with our doctors. I remember when I first moved here in 1960, I went to a doctor in Manchester, Pennsylvania, and he was in like a little house, kind of a residence, and he was from the Philippines. But he would do everything. I mean, the idea was that he wasn't just a manager of medical care, getting me to the right specialist, but he would do everything, pretty much, unless the hospital was absolutely needed on that. That's such a fading breed now. I mean, the idea of coming to the house, the idea of being there all the time, the idea of it being a positive experience, the idea of having those people out there, and then making sure those people are happy. I mean, nobody wants to go to an unhappy doctor, right?
And that's exactly right. And that's what direct medicine tries to do. We increase that quality of life for our physicians. We give them a moral boost. Doctors went into medicine to take care of people. And right now, the average face-to-face time with a physician is 8 minutes. I can't take care of somebody in 8 minutes. I can't even get to know them and recap what's going on in their lives in 8 minutes. So what we do basically takes it back to the 60s, that personalized touch. That patient-physician relationship comes back to the forefront, and you really want to put that at a pinnacle, and that's what it's all about. It's about taking care of people, delivering exemplary care at an affordable price.
Dr. James, how do you do that? How do you get more time with the patient right now? Because obviously you're going to have a lot of people coming to you and saying, hey, this is pretty good. And they're going to come whenever they want to, pretty much. I mean, set up an appointment and come as many times as they want to. How do you do that and work it out where you do have the time to really sit down and get to know them? Because I think that's a very laudable thing.
Yeah, that's a great question. And what we do is we limit the number of clients per physician. So an average family medicine doctor is going to see 4,000 to 5,000 patients just to keep the doors open. In our model, because we charge that monthly membership fee, we take on 500 to 600 clients per doctor. So there you have about a 90% reduction in the amount of patients that you're going to be seeing, and that allows you to really to dedicate more time to each client. So our visits are about an hour long, and then, at the end of the day, we're not charging for hours because we're not billing insurance. So we have more time to spend with our families, and we're energized, and we're ready to go in the morning, and we're motivated, and we're excited about delivering exemplary care.
We're talking with Dr. James Pinkney, family practitioner and CEO and founder of Diamond Physicians. He goes by Dr. James. One of the biggest challenges, I was reading this one article, to boosting the rural physician workforce is the funding of residencies. Once a doctor finishes school, and I know you've been through all this, you got a supervised 3-year residency to hone his or her skills. That's typically required. And then the research shows that where a doctor does this training is a strong predictor as to where he or she will practice. But historically, federal dollars for residencies mostly have been spent on teaching hospitals, often located where? In cities. So these newly minted doctors are not exactly going to run out with all this sophisticated technology and head on out to the rural areas, are they?
No, they're not. And the money, unfortunately, goes to where the most lobbying dollars go as well. So the people that get all these federal funding are your large hospital institutions, and they're going to be training specialists because the specialists generate money, generate revenue for the hospital. So that's the issue. It goes back to our capitalistic society.
Do you see, and again, Obamacare you're kind of an answer to Obamacare in a lot of ways because it's a way to kind of, I don't want to say skirt it, but it's a great alternative, put it that way. Do you see the country going in your direction? I guess you guys are called, concierge medicine a lot of times too?
Yeah, we call it affordable concierge,
right.
Direct medicine. But yes, this is the answer to our healthcare crisis. There's no doubt that in the next 2 to 3 years, every U.S. citizen will have to pay a little bit extra for getting the care they deserve.
Now,
and when it breaks down, you actually save money in the long run. So a lot of people are like, oh, why would I pay $95 a month to see a doctor? I'm never sick. I'm always healthy. Well, it includes all those things, those laceration repairs, IV fluids, any acute medications that we administer in-house. And that saves you thousands of dollars down the line from those ER visits.
Well, the other thing you would say, too, maybe as an argument, I'll be devil's advocate for a moment. You'd say, okay, why would I get into a plan where I have a $5,000 deductible that I'm never going to use because I'm very healthy right now? Yes, I have to pay more money a month to have the potential for that deductible than not. I mean, that to me, your way of doing it right now seems a lot more commonsensical than that does.
It does, because you actually get something for your money. If you don't use that deductible, do you get your money back? No. With us, you're paying us a monthly fee, and you're actually receiving a service. You have a doctor on call for you 24 hours a day. It's absolutely remarkable. So I agree with you 100%. And what they don't want you to know is that 93% of people don't hit their deductible every year. Only 7% of people do.
You know what else is interesting? That's a really great number. What else is interesting, though, is you now, where you might tend to stay away from using certain things, you might tend to stay away from going to get those tests that maybe are very, very important to you and you don't even know it. You now would not hesitate in doing that if you were paying this monthly fee, and they would come to you and say, okay, by the way, I can keep my doctor in this case. I've got the one I want. I can stay with you. You've got a relationship, and you can now be more preventative and proactive, I would think, in the types of things you're going to do with that patient, whereas before, we're sitting there saying, geez, I don't know if I want to use that because I got to pay this, this. Now it's not the case.
Absolutely. There's no copay, so you don't de-incentivize your clients for coming in to see you. You pay your monthly membership fee, unlimited visits, come in and see us on your time. So that's exactly right. That's a huge point where we're trying to focus on prevention and being proactive. Come to see your doctor every couple of months. Don't wait till you're sick. Let's check your blood pressure. Let's get a cholesterol check. Let's do all these things to be proactive and prevent heart disease, diabetes, stroke, all those types of things.
I'm sure there are a lot of people sitting out there. Even though you and I have talked before, I always find 18 million more questions I want to ask you. And one of them is people say, well, why don't you have to go along with Obamacare? Or do you have to go along with Obamacare? And if so, in what ways?
We pair people up with a high deductible plan, a catastrophic plan, because we believe you do need some sort of coverage in case of an emergency.
Right.
We want people to use their insurance, kind of like your car insurance. When you have your car and you need gas, you don't file an insurance claim, you pay cash. If you need new tires, if you need an oil change or new windshield wipers, you pay cash. That's how medical insurance should be used. For small things, everyday things, maintenance, prevention, pay cash. But if you need surgery, need cancer treatment, have to go to the ER and spend several days in the hospital, that's when you use your catastrophic plan. And that's how we can eventually lower the cost of healthcare in America and start making it more affordable for our nation.
Dr. James, when we come back, I want to talk to you a little bit more about doctors being overextended at full capacity, the growing challenges for patient access. We'll continue to talk a little bit more, too, about this concierge-type medicine, this direct medicine that you're getting right now, a different concept. Dr. James Pinkney here to talk more about it. I hope you're as intrigued as I am, because I think this is a great alternative for a lot of people looking out there. We'll find out, are there any places coming to our place soon that have this kind of medicine, or are they already here? We'll ask Dr. James that question when we come back, right here on The Gary Sutton Show on News Radio 910 WSBA. Welcome back to The Gary Sutton Show. We're talking with Dr. James Pinkney, who is a guy who's given us an alternative to Obamacare. Is CEO and founder of the Diamond Physicians. And I was just reading a tweet that the same guy sent to me, 2 tweets here, Dr. James. I wanted you to react to that. He said, no way primary care shortage won't be worsened by seeing 600 patients versus 3,000 in the short term. And then he also had this to say. He said subscription is a great model, but cash fee for services also. Bottom line, use insurance for its purpose. Your reaction to that?
No, I agree with that. In the short term, direct medicine will create a little bit more of a shortage, but in the long term, it will incentivize more medical students to go into primary care and make up for that gap. So yes, short term, we will have a little bit more of a drop. but there's no doubt that we're already hemorrhaging right now. So we've got to do something to incentivize medical students to go in to primary care. Like I said before, it's less prestigious. The surgery, the specialties are much more prestigious. Primary care doctors make 50% less. It's a non-sustainable business model. They're seeing 30 to 40 patients a day just to meet overhead. It's not going to work.
The morale out there right now, I'm hearing about a lot of people who are quitting out of not only the rural areas, but urban areas as well. And they say that I'm looking at some of these additional survey findings in this one survey, and it says 85% of physicians surveyed indicate they have implemented electronic medical records, yet only 24% say that EMR systems have improved efficiency, and only 32% indicate that it's improved quality of care. Nearly half of the respondents noted that the EMR systems detract from patient interaction. 39% of physicians indicate they will accelerate their retirement plans due to changes in the healthcare system. 26% of physicians now participate in an accountable care organization, though only 13% believe ACOs will enhance quality and decrease costs. 50% of physicians indicate implementation of ICD will cause administrative problems in their practices. It goes on and on and on. And the picture of that's painted is it's not a very good profession to be in under the present circumstances.
It's not. Physicians are leaving left and right. New medical students aren't entering primary care. Older physicians are retiring early because they can't keep their doors open. So whatever I can do to capture those physicians that are already leaving, yes, they're not seeing as many patients, but if they're going to leave, seeing 600 patients is better than zero.
You know, one of the things that was mentioned here in the beginning was about Medicare. On average, physicians surveyed said 49% of their patients are enrolled in Medicare or Medicaid, yet 24% of the physicians surveyed either do not see Medicare patients or limit the number of Medicare patients they see. 38% of physicians either do not see Medicaid patients or limit the number of Medicaid patients they see. Do you feel a void there at all in terms of how you can then deal with Medicare and Medicaid patients who are being left out in the cold, so to speak?
Yeah, we have a lot of clients on Medicare and Medicaid because we don't deal with the government payers at all. So we offer reasonable pricing, 24-hour access, and our clients absolutely love it. And then if they want to submit a claim on their own, they can. But a lot of times our prices are so much cheaper that they save money by leaving the insurance card in their pocket. Let me give you an example. I had a client on Medicare. He suffered a shoulder injury. He was riding his horse, got bucked off the horse, suffered a shoulder injury. I sent mobile x-rays to his home. His deductible is $4,000. Well, he paid cash for those mobile x-rays, $150. I looked at the x-rays on my cell phone. He had a glenoid fracture, a shoulder fracture, brought him in, examined him, put him in a sling. I also thought he might have had a rotator cuff tear. Well, I got him a same-day MRI. That MRI would have cost him $4,000.
Right.
I got it for $400 with contrast and a radiology read. Okay? Then I got him into an orthopedist the next day because we have a diamond network, and all of our clients get in to see specialists within 24 to 48 hours. He was in surgery the day after that, and then Medicare paid for the surgery. That's an efficient use of insurance dollars.
Wow. You know, one of the other results of this survey, 20,000 physicians. Physician survey said they work an average of 53 hours per week and see approximately 20 patients per day. Doesn't seem like a lot.
That's actually low.
Is it?
I would say physicians work closer to 60, 65 hours a week and see at least 25 to 30 patients a day.
Right. Now, how many patients do you see in your particular brand of medicine that you're practicing on a given day?
6 to 8 patients.
Okay.
But again, this model can be tweaked. We're on the more the high-end spectrum of direct medicine, but if you want to tweak it for underserved and rural areas, you can spend 30 minutes with a client instead of we spend an hour. So then you can double it to 1,200 clients, and that is a perfectly reasonable model. Again, I told you that the average face-to-face time is 8 minutes.
Right.
So if you move it up to 30 minutes, you're still tripling that average face-to-face time.
Are there any other? They probably are other agencies like yours in the country, but are you seeing a national movement anywhere? Is it? If it is, it's one of the quietest movements I've ever seen.
We're at the very early stages. There's a handful of physicians around the country that are promoting direct medicine. Right now, MDVIP is our largest player, but they still utilize the insurance model. So you pay an extra $1,500 a year, but you're still paying a copay. You do not get 24-hour access to your physician. You just get to see, you have same-day availability. So our model is completely different, but we are a franchise. So our goal is to have a Diamond Physicians in every city in the next 10 years.
So here in Pennsylvania, we could expect to see you here sometime in the next 10 years, right?
Absolutely.
Let me ask you one final question. I don't think I've ever asked you this one in the times we've met so far. How did you ever get the courage to do this?
That's a great question. I was actually a surgery resident. I did the same thing. I went for the specialist. I originally wanted to make a little bit more money, pay off my debt, and I was a surgery resident at a Cedars-Sinai in L.A. And
big-time hospital.
Yeah, big-time hospital, unbelievable facility, celebrity hospital. And I was taking care of a celebrity patient one night and doing some post-surgical rounds, and they asked me to call their doctor. I said, are you sure? It's 11:30 at night. He said, yeah. And at Cedars, you kind of just do what your clients basically ask you to do. So I called the doc. Doctor was very gracious, reported the post-surgical issues. They said thank you. I hung up the phone, and that was my first taste of concierge medicine, and that was about 8 years ago. And I said, wow, how can I make this service available for everyone and not just the super wealthy?
Wow.
And that's when the wheels started turning, and I said, okay, I got to get out of surgery. I need to switch over to family medicine, and I switched to do this, to create a direct medicine model that was affordable but still delivered exemplary care.
And it's working very well. Diamond Physicians. Dr. James, always great having you on the show. I look forward to our next time very soon.
Oh, thank you so much for having me on the show.
Thank you very much, and have a great day. Dr. James Pinkney with us here on the Gary Sutton Show.